Well, good morning, everybody, and thank you for having me here. I represent the plan side. I, by my previous history, am a board-certified family physician. Practiced and decided that working with managed care was very difficult. I thought there was a better way to provide care. From that time, I've been working with most of the nationals, Aetna, Anthem, Pacific Care, Humana, and right now I serve as Chief Medical Officer and Vice President for Sharp Health Plan. Just to level set so you know where my conversation is coming from today, Sharp is the largest integrated delivery system in San Diego. It is the highest market share of any plan or any integrated system within California. We have the whole continuum of care. We have acute care hospitals, we have specialty hospitals, which include behavioral health and substance abuse. We have our medical groups, we have outpatient clinics, the list goes on and on. Suffice to say, every part of care that needs to be provided to our members is provided by us. Also, as part of the health plan, we have about 150,000 members as part of our plan. So that gives you a little bit of background on, who we are and what we do. But at the end of the day, what are the results? Because if you don't look at healthcare differently, especially related to the great people that are making a difference moving forward in healthcare in terms of combining and treating patients more holistically, you don't get these kind of results. We have one of the top-rated health plans in the country, 4.5 stars. Medicare, 4.5 stars. California has the most sophisticated health plans in the country. I think many of you would agree. And yet, with that being said, for the last 5 years in a row, we've been seen by our members throughout the state that we are rated the highest in terms of member experience. So there's a there, and I want to give you a little view as to what that is. But first, from my perspective, as somebody that is involved in trying to keep patients healthy or get them healthy, what am I dealing with? What is the problem that I'm trying to solve for? And that is value. If you look at healthcare today in the United States versus other parts of the world, the sentinel measure for healthcare quality is life expectancy. This is very distressing, and it's been stated here already that we're not doing a real good job. Compared to other industrialized countries, you can see that life expectancy is not as good in America as it is in these other places. To compound that, look at how much we charge. The cost per capita is 2 to 3 times more to get these kind of results. And as it was stated already, if you look at the tail that goes on from 2014 to today, you see that there's actually a decline in life expectancy. What does that mean for you and I? That means that our children and our children's children will be the first generation in decades that will live shorter lives than we will. That cannot happen. We cannot allow that. We have to do more. So let me give you what we have developed as a solution to this problem and what we have implemented over the years. This idea of population health. Everybody talks about it's kind of the flavor of the month, but there's a difference between actually doing it to the full extent possible and to nibble around the edges of it. So everybody has a different definition of what pop health is and what it actually means. For me, it's a very simple definition. It is that we have the ability to analyze big data of a population to be able to manage the individuals of that population. And this is done, and our model is designed to manage our patients holistically. What does that mean? It's not siloed into medical, behavioral health, pharmacy, as it was in years gone by, but it's actually integrated together. And it's built on the 4 premises of improve the patient experience, and that you saw our results, decrease costs, improve healthcare outcomes, and also enhance the physician experience. So that's the quadruple aim, those of you that know about that. So one of my questions is, why do this? I'm asked it all the time. So let's just look at it strictly by the numbers. If you look at it, 40% of patients that go into the primary care's offices, they have behavioral health issues, they have mental illness. 27% will have a substance abuse issue. Over 30%, and the statistics go anywhere from 29 to 60 on this, but say it's 29% of patients that have chronic disease, medical chronic disease, diabetes, heart failure, and so forth, will have underlying behavioral health issues. And what is the most telling of these statistics is the last one. 67% of members with behavioral health disorders do not receive the care that they need. So this is the problem that we have by the numbers. So is there a value proposition? Because you know I work for a health plan, and we only do things where there's value involved. Actually, the studies are showing that there is value in this, substantial value. You've heard some of it already. There's increased access, there's improved outcomes, there's improved compliance, and also decrease in terms of total cost. That is a proposition that you can't stay on the sidelines for. So let me give you a brief view into Sharp Health Plan's population health model. Now, usually it takes me an hour to just talk about one of these things, and could take a whole semester to talk about all of them, but I'm going to try to do it really quick for you right now. First, we start out with data integration. We have a data warehouse which is unified for all of our organizations. Claims, clinical, as well as administrative data all comes in. Then we look at analyzing all of this big data with a predictive modeling tool, so that way we're able to segment our population into these various categories throughout the continuum of health, both on the physical as well as the behavioral health side. For each one of these, there's programs, services, and results. And then we stratify these members not only to the risk today, but what it's expected to be in the next 12 to 24 months. We take that robust data, information, and reporting and provide it to the providers that are caring for our members. And you can see that the members are in the middle of the care. It's actually the members and their families that are in the middle of their care. Then we wrap around collaborative efforts and targeted approaches to help our members. We then also have safety initiatives which affect all of our members, and then look to have advanced access opportunities for them also. But then we have to see what we did, does it mean anything? Are we making a difference? And in fact, that's what we do, is reporting back to determine, are we making a difference? Are we actually improving care for our members? And then we make tweaks or wholesale changes to our system to continue to improve, because healthcare is a dynamic, right? You never step in the same river twice. And then lastly, component that is truly important, and I think critical, is that of value-based reimbursement. The idea of fee-for-service is not connected at all with anything related to quality. That needs to change in America today. So let me talk to you really quick about, call out two specific issues related to healthcare and our model. One is the impact of social determinants. You've heard it before. I know that that's a big issue, but how much of the care that we deliver improves the total health of our members? I know you wouldn't find it surprising to see that it's only 20%. Actually, 80% is related to the social determinants. That is related to health behaviors, that's related to socioeconomic insecurities, as well as housing. I could talk to you for a long time on the statistics and the studies that have come out to show the value in addressing these needs. But let me just take housing as a premise for this. If you look at the life expectancy that I showed you before, in the United States, it's 79 years. But then if you go ahead and look at those that are chronically homeless, it's only 64 years of age. Again, you could see statistics like this across the board. Next, I just want to leave you with the idea of increasing access. We live in a day and an age of 2020 where people don't want to get their care anymore in a big, beautiful building with the best doctors and providers and beautiful artwork and landscaping. What they want is care when they want it, where they want it, for the conditions that they have, and for the severity of their problems. I kind of break that up into three components, one being the on-site care, which is your bricks and mortar, right? It's your primary care and specialty, your hospitals, your urgent care, and so forth. And then you have the near-site care, and that's related to your worksite wellness programs, we have relationships with MidaClinic, with CVS, and your pharmacy partners where they can help to educate and provide care. But the biggest area of opportunity is that of telehealth. Now that is a big area. It's not just talking about text and online visits and emails, but it's also remote monitoring and expanded home health and digital member management, and it's also AI. AI is critically important also. So just in closing, we are committed to best-in-class behavioral health integrated strategy. Those are the 5 principles that I believe you have to have if you're going to have a truly integrated system between behavioral, medical, and pharmacy.
Thank you so much.
Thank you.